This is breaking news from the Las Vegas Review-Journal, sponsored by Las Vegas Paiute Tribal Smoke and Cigar Shop.
Good morning, I'm Renee Summerhour. We are following a breaking news story here at the Las Vegas Review-Journal related to the COVID-19 pandemic. Earlier this morning, Governor Steve Sisolak announced an initiative aimed at distributing the COVID-19 vaccine more equitably between racial and ethnic groups in Clark County. According to a statement, state officials will work with Clark County and the Southern Nevada Health District to clarify priority lanes, support free or fair access, I should say, through this selection, and allow equitable allocation across communities. The governor released a video this morning expressing his dismay at the inequities between racial and ethnic groups when it comes to the vaccine distribution. Here's some of what he had to say this morning.
Clark County is facing an equity crisis. It must stop. As a former Clark County commissioner, I know these zip codes well. I am alarmed at what I am seeing. What the data shows is clear. There is a disparity in who is receiving the vaccine that does not reflect the demographics of that region. Additionally, the zip codes that continue to experience the highest number of COVID-19 cases are the same zip codes with the lowest frequency of vaccinations. That makes no sense.
Review-Journal investigative reporter Michael Scott Davidson has been part of our team coverage of COVID-19. He now joins us live. Michael, what do you make of what the governor said this morning?
Well, the governor is referring to Southern Nevada Health District data that shows that Black and Latino residents of the Las Vegas Valley and Clark County at large are getting vaccinated at rates that are disproportionately low to their share of the population. For example, Black residents make up about 12% of our county population, but only about 6% of people who have been vaccinated so far of the people who have shared their race and ethnic identity. The governor also pointed to a problem that people in zip codes that have been particularly hard hit by the virus are not getting vaccinated as much as people from other zip codes. In particular, we see the 89110 zip code, which is a primarily Latino zip code that has seen the worst infection rate of any in Clark County. It's in central Las Vegas, I should say East Las Vegas, and I believe he's alluding to that when he talks about that. Clark County has tried some pop-up sites in these neighborhoods. However, the outcomes of those by just placing the vaccination sites in neighborhoods that have more diverse or Black and Latino communities, we're not sure exactly how that's worked out yet because anyone from around the Las Vegas Valley can sign up for appointments there. So even though the vaccine site is located there, it doesn't necessarily mean people from those communities are being given priority access to those vaccines. So I believe this is all what the governor is considering and wants to address with this move today.
And just kind of an offset question from that, Michael, you know, with the tiers, there's been some confusion about the tiers. We're hearing 69 or older. We've heard teachers, you know, your first line medical workers. Is there misinformation about who should be getting these vaccines, and that's why the access hasn't been readily available for those communities?
Well, we know from our reporting at the Review-Journal by our reporters that in the first few weeks of the rollout to the general public for people age 70 plus and certain priority workers here in Southern Nevada, that there were people that were able to get vaccines that weren't exactly in those groups, or there was questions about whether they were. The security at these sites has been tightened, and that's happening less from what we understand. However, what the governor was honing in on today was just because you're in a eligible group of workforce doesn't mean that you should be getting the vaccine. And what he means by that is if you're working from home and you're doing your job remotely, you're not having to go out and face the public as part of your job right now, you're not supposed to be getting vaccinated, even if your group of employees that you're in is in a priority lane right now. So he wants to see people that are working from home, working at their computers at home and don't have to leave, not get vaccinated so that the people that are truly on the front lines and our older citizens can get priority access to that vaccine.
Thank you for that, Michael. Meantime, the Southern Nevada Health District has opened a site for people to get their second dose of vaccine at the convention center, but there's been a big change on how they're actually administering the vaccine this time at that location. Michael, can you explain?
Yes, you're absolutely right. There was a big change announced this week by the Southern Nevada Health District. So they are doing second doses at the Las Vegas Convention Center. However, there was previously a requirement that you had to have an appointment to get your second dose there. And this week that was lifted. There's going to be walk ins for second doses for the next 4 weeks. However, there's some major stipulations here. First of all, you have to have received the Moderna vaccine, not the Pfizer one, to be eligible for this. And you need to have received the Moderna vaccine between January 4th and 9th. Furthermore, there are some restrictions on basically where you got that Moderna vaccine. If you got it at one of a few sites, you're eligible to do these walk-in appointments. And I would encourage everyone to go to reviewjournal.com where you can read all about this in depth. Now, the convention center is opening this site Tuesday through Saturday, and eligible walk-ins are going to be accepted from 8:30 a.m. to 2 p.m. Again, Tuesday through Saturday until the vaccine doses run out. So make sure that you go to reviewjournal.com, read up on this, make sure that where you got your first vaccine and what kind of vaccine you got corresponds to see if you're eligible for this, because if you're not going to be able to do a walk-in, and use that information and get down there if you are eligible for this second shot as a walk-in appointment at the convention center.
Michael Scott Davidson, always an abundant source of information for us here at the Review Journal. Thank you very much for joining me this morning.
Thank you for having me, Renee.
And we will continue to follow this developing story. So please stay with us, and we will keep you updated as well on our evening show at 7 p.m. I'm Renee Summerhour. Thank you so much for joining us today, and have a great day.
You've been watching breaking news from the Las Vegas Review Journal, sponsored by Las Vegas Paiute Tribal Smoke and Cigar Shop.